Hello, Rob Orr, clinical myotherapist and credentialed Mackenzie therapist. Welcome to my consultation room. Today we're going to talk about the sacroiliac joint. And the sacroiliac joint, I'll show you what that is very shortly, is basically made of up of your lower back and your sacrum and your ilium, which is the hip. And that joint, like so, is held together by a lot of soft tissue and myofascial slings that surround the area. And of course lots of ligaments as well. Lots of nerves go through that area as well. It's a weight loading joint and very important for picking up sort of proprioception changes, etc. Now, it can be quite confusing when we do have sacroiliac joint pain. Is it actually the sacroiliac joint or is it the lower back that's referring to that area and sort of mimicking sacroiliac joint pain? So if you've got one-sided back pain and that discomfort is more sort of just below your belt line, so approximately just around this area here, like where there's a dimple in the lower back and it's tender on that area, and with associated discomfort that can radiate into the buttock and to the top of the hamstring, and discomfort that can actually wrap around into the groin area as well. So that's what the sacroiliac joint can do, and so can the lower back. So it's very important you clear your lower back first to rule out a disc bulge prior to going into the sacroiliac joint. So if you are suffering from one-sided lower back pain that does mimic those symptoms that I mentioned, then what I want you to try is doing the repeated extensions in line first. That's on my YouTube channel. And if that doesn't work, then I want you to try doing the repeated extensions in line with the hips off center. That's on my YouTube channel. Now, if that's not working for you, I'd now like you to try this particular exercise. So it's an exercise for what's called a derangement of the sacroiliac joint. Derangement means a obstruction in that joint. And so we're going to try to move that joint through the obstruction, and it should get easier and easier and easier and more comfortable if it's the right exercise for you. So once again, this is the exercise to do for the sacroiliac joint if you've cleared your back with those other exercises. This is the first one I'm going to do. The sacroiliac joint either responds to repeated extensions or repeated flexions, basically. And we're going to just use that terminology to keep it very, very simple. So, once you've cleared the lower spine, and part of your symptoms is that you actually feel better standing and feel better walking, and you feel worse sitting, then I want you to try this one. Repeat about, say, 10 to 20 times. Probably preferably 15 to 20 times, and see how you go. So I'm just laying down. This is my right side. This is approximately my sacroiliac joint is, just here, my belt line area, or just below it. And what I'm going to do now, I'm going to bend my right knee. And all I'm going to do now is just repeat, lift as high as I can, extension, to my comfort zone, or to the edge of my pain, come back down. And how easy is this one? High as possible. And I'm just going to repeat this, like I said, 10 to 20 times. And if it's the right exercise for you, it should get easier, it should get more comfortable, and you should increase your range of motion as well. And then you can retest to see how you feel after that. Right, so that's the repeated hip extensions. Now that's a very low load exercise, so you could start with that, but then you probably have to progress to another exercise after that. I'll demonstrate that now. So I'm in a lunge position. My right leg is behind me. And if you have a balance issue, you can use the wall, like I've got here. I'm putting one hand on the wall, putting my left hand on the wall. And what I'm going to do now, this is the exercise for the right side of the sacroiliac joint. It's a progression from the one I just showed you. And what we're going to do is that we just lunge forward like so, lunging forward, get to the edge of your discomfort. Now if you're comfortable, put one hand on the upper butt area and then give a bit of a push in that same direction. So we push it and hold for 2 seconds, and then we come back to neutral. And we're going to repeat this 15 to 20 times all the way into the lunge. You sort of can't go any further, but you're relatively comfortable. Hand on the upper butt and push the hip further into extension. 1, 2, and then come back. Repeat that again all the way into the extension. Hand on the upper butt and push that right hip further into extension. 1, 2. And then once you've done your 15 to 20, I just want you to retest your symptoms and see how you feel. Now just give it 30 seconds of walking around first, because it can be a little bit sensitive to start with. Maybe you're moving things around. You know, you've got mechanical pain in there that's causing a lot of sensitivity. So it just might need to settle down for about 30 seconds to 60 seconds after the exercise. So once again, this is a good exercise for the sacroiliac joint once you've cleared the lower spine. And once again, if you're better standing and walking, this would be the appropriate one to do for the sacroiliac joint. Thank you.